Smallpox, polio, rubella, measles, and diphtheria killed an average of 650,000 people annually during the 20th century, according to Chris Mooney in the article entitled, "Why Does the Vaccine Autism Controversy Live On?" But now the virus kills less than 100 people each year. Why? Because of vaccines. We all want what is best for ourselves and our loved ones. I do not want anyone to suffer and possibly die from illnesses that could be prevented with a vaccine. According to Dr. Cody Messer, Chief of Pediatric Infectious Disease Services at New England Medical Center, in an article written by Melanie Howard entitled "Behind the Vaccine Controversy," even though we don't see disease, the germs that cause these illnesses are around. As soon as there is relaxation of vaccination, there is a resurgence in illness. Today, I would like to talk to you about vaccine safety and disease prevention. First, let's talk about vaccine disease prevention. In the article entitled "Expert Review of Vaccines" by Archana Chatterjee and Catherine O'Keefe, vaccines are responsible for preventing many diseases and preventing human suffering and disability. Vaccines are one of the most important medical achievements. Due to the success of vaccines, many people today have little or no knowledge of vaccine-preventable diseases like smallpox, rubella, and measles. They don't remember or they don't know what it's like to have lost a loved one to these horrible diseases. Before the invention of vaccines, more than 175,000 Americans contracted diphtheria. More than 500,000 contracted measles. Greater than 15,000 people got polio. And finally, diphtheria, measles, and pertussis killed more than 20,000 people in the United States annually, according to Melanie Howard, a writer from Baby Talk magazine. Now, thanks to vaccines, many of these debilitating illnesses have been largely wiped out. People have forgotten what these illnesses are capable of, so they are not motivated to get the vaccine. Individuals opting out of receiving vaccines have increased over the past few years. According to Melanie Howard, that in a recent study published in the Journal of the American Medical Association, that the number of people that are not getting vaccinated has doubled, which could increase the rate of contracting measles alone by as much as 30.8% in vaccinated people. For vaccines to be effective in stopping the spread of disease, everyone needs to get vaccinated. When vaccine rates decrease, then it goes to reason that the disease rates will increase in the population. I do not want people to contract infectious diseases. Do you? Next, let's move on to the safety of vaccines. In an article, "Behind the Vaccine Controversy," again by Melanie Howard, Dr. Schwartz of the CDC states that most vaccine reactions are minor, like swelling and redness at the injection site, headache, a slight fever. Rarely will the vaccine cause serious side effects, like brain swelling, which is called encephalitis, or seizures. Melanie Howard stated in her article, according to Dr. Neil Halsey, director of the Institute of Vaccine Safety at Johns Hopkins University, that vaccines are 1,000 times safer than getting the disease itself. An example of this is if you contract rubella earlier in your pregnancy, you will probably be fine, but your unborn baby will be at an increased risk for serious birth defects and maybe even death, which could be prevented with the MMR vaccine. The MMR vaccine also prevents mumps, which can cause deafness to your unborn baby. We need to protect those most at risk, which are our unborn babies and our young children. According to Dr. Neil Halsey, a child has a 1 in 1 million chance of developing encephalitis, which is brain swelling, from the MMR vaccine, but a 1 in 1,000 chance of developing encephalitis from contracting measles itself. The last major concern people have with vaccines is the fear of their child developing autism as a result of receiving the MMR vaccine. The MMR vaccine did have a preservative in the past called thimerosal, which some believe causes autism in children. Today, however, thimerosal has been removed from the MMR vaccine. Yet autism rates still are increasing here in the United States. According to Harvard's McCormick, in the article entitled "Why Controversy Lives On" by Chris Mooney, if you thought thimerosal was related to autism, then the incidence of autism should have gone down, but it hasn't. Due to social media, the fear of a child developing autism from vaccines continue, even though vaccines have been deemed safe by most in the scientific community. It seems to me that there are risks with anything we do, even getting in the car to drive to the store. But with vaccines, the benefits of receiving the vaccine outweighs the risk associated with them. I hope my speech has helped convince you to get vaccinated today for your health as well as for the health of those around you. My purpose in giving this speech is to convince those who are not vaccinated to get vaccinated. Finally, according to Amanda Paulson in the article Beyond Us and Them, the role of trust in vaccine controversy, that the science around vaccines is clear. They do have a small risk, but have a great community benefit. They help to protect those individuals most at risk. Let's protect those individuals by getting vaccinated today. Thank you.